We have to remember who we are.
Sickle cell disease is characterized by a modification in the shape of the red blood cell from a smooth donut shape into a crescent or half-moon shape. The misshapen cells lack plasticity and can block small blood vessels, impairing blood flow. This condition leads to shortened red blood cell survival and subsequent anemia, often called sickle cell anemia. Poor blood oxygen levels and blood vessel blockages in the people with sickle cell disease can lead to chronic acute pain syndromes, severe bacterial infections, and necrosis. With me today are Deslin Ann Cush, Francesca and Agustina Stephen from the Sickle Cell and Thalassemia Patient Network. Thank you, ladies, for being on the program with me today. It's a topic that is so interesting, and at the same time it's heartbreaking to see so many different persons, so many thousands of persons from across America and even millions across the world suffering from such illness. So first we're going to talk about, I know you also have sickle cell, yes, and also Deslin, you too have sickle cell. Yes. So we're going to talk with both of you as to the type of sickle cell that you have and the experience going through or living with sickle cell, starting with you.
I have SS disease. They consider SS the most severe type of sickle cell disease, but I don't think that there is a more severe type. I think our experiences may be a little different, but I don't think that one form of the disease is more severe than another. I have experienced a good amount of sickle crises, infections, pneumonias, acute chest syndromes, and even necrosis. But I also know that with and through my experience, it's important to get back up on the horse and, as they would say, and keep on going.
Right. Wow. And Deslin, talk to me about your type of sickle cell.
I have sickle cell SC disease. And with that, I have hemorrhage in the eyes. I had 3 laser surgeries. Wow. I do suffer from pains. I had pneumonia also several times. I almost died in '96. In '96, I took it with flu-like symptoms and thought it was the flu. And, you know, everybody telling me to go to the doctor, and I told them it was the flu. Right. A friend came to see me, and she told me to go to the hospital, and I told her no, and I went back to sleep. And my father had died that same year. And when I went to sleep, he came to me and told me, Deslin, you lying there dying. And I jump up and told my sister to call 911. When I got to the hospital, being that I went to the ambulance, the doctors saw me first, and I passed out cold. Oh, wow. And did not remember I have the sickle cell, because in '93 when I had my daughter, they diagnosed me with sickle cell. Right. So it wasn't bothering me that much. Right. But a guy that was next to me laying in the hospital, he told me he's there for sickle cell, and I had a red light moment then. Right. And I told the doctor, when the doctor rushed the test, because it is a special test, you just can't take a normal blood test and get back the results for sickle cell. Right. So when they took that special test, my blood count level was a 2. And the doctors told me any more longer I could have died. I had several pneumonia attack pains and all that. And that is what saved my life. I think that although my father was dead, he still saved my life. He's still taking care of me with the help of the Lord, of course.
Right.
Yeah.
Wow. Wow. And I know not just the patients, but the family members who have to be around you to see what's going on.
Yeah.
Yes.
Mom, talk to me about just watching your daughter going through all of that.
It's tough.
Oh.
That's a very tough experience. And listening to these two emotionally gets me all riled up. It's been a hard journey, very hard. And at times I get very low. But just watching them every day get through it is the best a parent can hope for. As a parent, you're the coach, you're a doctor, you're everything. You're their strength. And many days, they can't see us be weak. We have to have the strength. And it gets tough, it gets hard. But them seeing us strong makes them strong. Because I know there are days when Deslyn has her low days, Francesca has her low days, and they look to me as the source of comfort and strength. They see me getting up every day, doing what I have to do, and that's where they get their strength. The caregivers are the strength.
Oh yes, oh yes, and I'm sure for us and on health and wellness we try to showcase not just the patients, because I'm sure that the caregivers are
big part of their
a huge part of the patient's lives, because sometimes as persons going through different illnesses, they need that support to pull them through that day. When I want to talk to you, Francesca, about, could you remember one of those worst days that it stands out in your mind, that you said, wow, I just today is the hardest day?
I think, yeah, I could tell you about a few, but I think it comes across differently. You know, over the years, I think I've developed a little bit of a tough skin. So, you know, when I talk about it, I don't want to make it seem as if it didn't affect me, but I also go into it knowing that I have to advocate for myself and I have to be tough, because, you know, my mom tries to be tough, but I know she is not that tough. She's very sensitive. Deslyn, they're very sensitive people, and I don't want to seem as bad as I am sometimes, because I don't want them to worry. I don't want them to cry or to feel like they are doing something wrong or haven't done enough. I remember when I had my TIA stroke, I was sick for about a week. I was going through midterms when I was in college, and I didn't want to miss any more class, and I didn't want to miss my midterms. So I just struggled through not feeling well, and I was having the worst headaches I'd ever felt. I made sure I went to all of my midterms, and then after I went to go see the doctor, you know, promising my family I'd go see the doctor. And I passed out in the elevator on the way to the doctor, and fortunately the clerk from my doctor's office actually found me coming out of the elevator as I passed out. And I woke up 18 hours later in the ICU, and they told me I'd had a TIA stroke. I don't remember the pain as much anymore. I remember the experiences, and I remember my thought process, remembering that I couldn't fall into weakness or worry in that moment because I had to get through it. Not to mention I aced all of my midterms. And I knew that I also had to get back to school because I wanted to maintain my grade point average, and I had internships. At the time I was working 2 internships, and I also had a part-time job. So I had responsibilities, and I couldn't fall into the sickness. I just had to move forward.
Oh, wow. Wow. These are the things that move me in terms of persons who are suffering with illnesses like yourself, who they're heroes. Heroes in the sense that the toughest days don't get them down. They get back up and keep moving, keep going, and keep thriving and keep excelling in everything that they do. And it's a wonderful thing, and some great things have become of all of your stories. And that's the network that you guys have. We're going to take a quick break. When we come back, we're going to touch on that in terms of the great work they are doing with the Sickle Cell Network. Stay with us.
Our football team's like #1 in the nation. So the band, it has to be full of energy and precise. I think it's kind of like therapy for me. It makes me feel like I'm normal. Like I can be normal. Music is life to me. Music is life. My name is Shania. I am 16 years old. I live in Batesville, Mississippi, and I have sickle cell disease.
Even if they don't have a chronic disease, it's hard to be a teenager. They really have to be on top of taking care of their sickle cell disease, in addition to being exposed to the regular world and daily activities of going to school, participating in a sport.
The first time I actually found out she had a disease was when we were at a contest, and I saw her get kind of weak, and we were marching off the field, and I saw her pass out.
She's always just like pushed herself, and she's just works so hard.
Most of our teens, they don't want to be different. They don't want to have to stop and take breaks because it makes them look different or feel different. It is a chronic disease, and it is very vital to their care that they have a place that they can go that understands their disease. St. Jude is one of those places.
St. Jude Children's Research Hospital is primarily known as a place that treats children with cancer, but really from our start, we have had a program to treat children with sickle cell disease. It was a devastating disease at that time, but we've made great strides in improving the outlook for children with sickle cell disease.
A sickle cell isn't round like a healthy red blood cell. It's more banana-shaped, which makes it harder for it to carry oxygen and can cause pain and damage throughout the body. Since sickle cell disease is an inherited blood disorder, it's something our patients are born with, and they have to deal with it every single day.
I came to St. Jude when I was around 5 years old. Growing up with sickle cell, it was really different for me. I couldn't do what other kids did, like go outside. It was a struggle, but I came to see that if I didn't have sickle cell, I probably wouldn't be like the person I am. I don't want sickle cell to define who I am. I don't want that to be a factor like, oh, she has sickle cell, or she can't do that. Just because I have sickle cell, it doesn't mean I can't do anything.
Sickle cell disease affects about 100,000 Americans, and 1 out of 400 African American babies have sickle cell disease. It's a lot of kids.
So we've had great success in managing children with sickle cell disease. Greater than 95% will be able to make it through childhood. Our efforts to date, though, have really been in managing their symptoms. Today, in the United States, when children transition into adult care, there is a rapid increase in the number of deaths that occur in this population of patients. This is unacceptable. We need to better educate our patients so that they can play a more proactive role in managing their care as they transition into the adult care environment. Simultaneously, we need to assist the adult care providers so that they know how best to treat the patients with sickle cell disease.
It's just nice to have a good group of friends that really understands. Because some days you're by yourself, and some days no one can help you at all. You have to fight it by yourself, and to be able to have a support group that just understands you, it's really a blessing. Taking pictures for me is kind of like a tradition I do on my birthday. It makes me feel loved. I do not want to be defined by my illness. Just not someone, that's sick all the time or has this disease. I want to be someone, that makes change. Just an overall amazing leader in person.
Thank you so much for staying with us on the program Health and Wellness. And in this segment, we're going to touch on the work the network is doing. But before we go into that, I want to ask the ladies about in terms of family members, not because I'm sure some persons have the support, but there are those who don't have that support. How should those persons deal with that? And how are those persons dealing not having
a lot of
support?
times they crawl into themselves. They become introverts.
Right.
People who have sickle cell disease need a support, some kind of a support, whether it's mother, father, siblings, friends, extended family, school, church, work, whomever. And the reason being that they're struggling with so much that without somebody to understand, show some compassion,
Right.
they get depressed a lot. A majority of the young people act out. The older ones go into severe depression and start taking drugs for the depression, or they don't want to interact with the world, period.
Right.
They lose self-esteem,
Oh, wow.
completely lose self-esteem. They just don't want to do anything. And that's because there's a lack of understanding in the general public. When your own family cannot believe that you're sick, it's tough.
Right.
When your parents don't believe you're sick,
Right.
it's tough. But it's hard to explain because what you see in sickle cell disease, you'll look at a person and say, well, she looks healthy or he looks healthy. They can't be sick, they must be faking.
You know?
And so it's hard to tell
Right.
when that individual is sick. When you can show up at an emergency room screaming in pain and the emergency room physician tells you that you're faking, that's the epitome of what they go through.
Wow.
People not believing that they're sick. This is the #1 problem with people who have sickle cell disease.
Right.
People just don't believe that they're sick. And so this is why a support system
Right.
is so significant.
Right.
In the case of my family, they understand. I have husband, siblings, sisters, grandmothers, everybody in my family is involved. Now I'm blessed. I will boast and tell you,
Right.
we are blessed. Not everybody
Not
has
everyone.
that support system. As a matter of fact, I would say a good 70% of people who have sickle cell disease have no support system. And I could go down the list and name a lot of people whose parents will, take them to church and have the devil beaten out of them because they think that they're faking. Now, something has got to be wrong with that individual to think that there's the devil that's making you cry out in pain. And I realize that we need a belief system in our lives
Right.
to keep us grounded.
Right.
But it's got to be something wrong with you if you're thinking that your child is acting when they're constantly telling you, I'm in pain, I'm in
Right.
pain. See, a lot of us don't believe in doctors. It's a fault of our society.
Right.
The way we're brought up, we are not brought up to trust. And so a lot of parents take matters into their hands. And that's where the level of communication breaks down.
Right.
Because they're thinking the child, well, they're not listening to me. I told them drink this, do that, that.
Right.
And you're not seeing results.
Right.
And so therefore you're hard-headed, you're stubborn, you're rude, and you must have the devil in you.
Right. Isn't sickle cell a disease that you get from either parent?
Yes.
Yes, it's an inherited blood disorder.
Right.
Inherited.
Right.
And there comes in problem #1. A lot of people don't even want to claim
Wow.
that that's in the bloodline.
Right.
So we've had children born with sickle cell disease whose parents have given them up for adoption because they don't want to claim that something's wrong with your blood. Okay? This is an inherited blood disorder. But while I have this opportunity, Roseanne, let's debunk the myth that sickle cell, only black people have sickle cell disease.
Right.
This is a disease that includes all ethnicities around the world.
Right.
Yes, it came out of Africa, okay?
Right.
But as we migrated and lived along the coastal areas and malaria-infected regions of the world,
Correct.
the body developed an immune system to fight off malaria.
Right.
And that's where sickle cell disease comes in. But those genes are passed on from one generation to the next.
Right.
So please, people, stop thinking that only black people have sickle cell disease.
Right.
It's amazing that it's finally being embraced, that sickle cell disease can pop up anywhere in the world.
Right.
Anybody has sickle cell disease. Right. But to know if you have the genes that will bring forth a child with sickle cell disease, you must be tested.
Right.
And Deslin alluded to that by getting the electrophoresis test at the hospital to tell her that, yes, she had the disease or trait.
Yeah.
One of our mantras at the organization is to be tested. You must know your status. Very important in life.
Right.
Okay.
And as you touch on in terms of Deslin, do you experience the same stigma that attached to sickle cell, seeing that you got tested and it was proven that you have sickle cell?
But she got tested here in America.
Right.
I got tested here as a child in Guyana. I born 7 months. They say, oh, she's sickly because she born 7 months.
Right.
And I came up here 86 December, and the January I took in with a crisis and couldn't walk.
Right.
At the time I didn't know it was a crisis.
Right.
And they didn't know why, because I did not know about sickle cell. And they just give me pain medication, one pain medication after the next, and it went away until 93 when I got pregnant with my daughter, who is now about to turn 21, is then I know that I have sickle cell.
Wow. And do you find, and this is coming from, based on what we're discussing here, do you find that in the Caribbean, for example, you find that they're lacking in terms of education?
Yes.
So persons are not aware of the illness, so they taboo the illnesses because they're not exposed to that.
Yes.
Right. So this is one of the missions of the
network.
The network and all of the networks that are out there. It's our education, because this is where we find that even people in our ethnicity still don't want to accept the fact that it's a blood disorder.
Right.
And so they suppress that feeling. You know, the less people know about me, the better off I am.
Right.
Well, I'm saying to you, I'm challenging people, get tested,
Right.
because you have young people nowadays bringing forth kids with sickle cell disease and the complications, and if they only knew, they could have avoided having that child. You know, once the child is here, you're going to take care of it.
Yes.
But knowing that you have the disease, the best way to cure sickle cell disease is to not marry somebody or have children with a person that has the genes like yourself.
Right.
You understand?
All right. Let me talk to you also in terms of your personal experience with persons. Do they stigmatize you with sickle cell, or you have it a little bit easier because you get the opportunity to explain to people what sickle cell is?
Yes and no.
Okay.
When I was younger, I went to a predominantly Caucasian school, and as one of the only 3 black children there, the only one with sickle cell, I remember certain comments being made. I remember not being allowed to use the water fountain because they were afraid to catch sickle cell.
Oh, wow.
Yeah.
Yeah, people think you
People
catch
think
sickle
you
cell.
can catch sickle cell, and
oh, wow.
you know, at the time my parents were not really educated on the disease. I was a child and could not advocate for myself. I knew it felt wrong on the inside. I felt horrible about not being able to drink at the same water fountain or use the same bathroom as everybody else. No child wants to be separated from the other children. And going to school, not being able to play in the same gym class, being separated from the other kids, it didn't feel good as a child. But I know that as I got older and learned more about myself and could advocate for myself, and even before I understood what sickle cell was, I was able to stand up for myself and let people know that I wasn't any different from them, that I can do anything that I wanted to do. I started my own dance troupe. I taught dance. I taught as a teacher's assistant in public school system. I, went to college. I educated myself. I dated and traveled and studied abroad. I came back, started my own business. I started a youth program at the hospital to educate other kids with sickle cell disease with 2 of my other good friends, one of which has passed away since. 2 of my friends passed with, the one that I started the organization with passed. And I now am a celebrity makeup artist, for whatever that means. And so, I feel like I can do whatever I want to do. I may not physically be able to climb mountains every day, but mentally I am just as powerful.
Oh, wow. You are. Let no one tell you you are. To overcome all these challenges and then achieve so many things. Yes, yes. And before we go, finally, in terms of the objective of the network, quickly explain to me what's the objective of having the network?
Advocacy, education, education, and education.
Oh, wow. Fantastic. And thank you so much, ladies, for being on Health and Wellness and to help myself and the entire team to bring education to the entire public who we reach. Thank you so much for staying with us on Health and Wellness.